We had the legalization of marijuana forum to discuss what happens, what are the things we need to be looking for, and what are going to be some of the consequences that we should be anticipating, and understand the issues surrounding not only the measure but also what happens afterwards. So we were very fortunate to have the director of the marijuana program from Colorado joining us to talk about his experience and presenting of the data that he's collected over the course of the last 2.5 years.
One of the things I shared today is that data is really just baseline data so far, and the conclusions to be drawn from them aren't as stark as you would want them to be, because a lot of these are complex ideas, notions, data sets that are going to take a long time to work their way through. I do talk about how it's really, the unlicensed system is a really hard thing to deal with, and what I would recommend to states is really tamping down on the unlicensed system, because that is where you're finding more criminal activity of people growing in as a home grow or as a medical patient, but then really using it as a way to make money selling it out of state. And so I think that's something to be concerned about.
We had the state director for the Drug Policy Alliance. We also had a representative from the California Chiefs Association in opposition discussing this, and we had a senior policy researcher from RAND Corporation talking about the research that they've done. My goal in this is to better educate and allow my constituents to have the benefit of an informed decision. Since there was so much talk and conversation also about the potential revenue flow that's going to be coming in, at some point I needed to step in and just make sure that we're keeping our eye on the issue, not just the revenue, the benefits of the revenue that are going to be coming in, because the benefits of the revenue can fade away very quickly if certain unanticipated consequences come our way that we weren't expecting and we didn't know how to deal with, and took up the entirety of the revenue and then bled into even the general funds. So I think we need to be very cautious, not to just be looking at the benefits, but try to understand how this is going to have an impact on everything else and the way we're conducting it.
I think that if you are on the pro side, you should be thinking about criminal justice and public health systems. If you're on the anti side, you should be thinking about commercialization and availability and what happens when those things go up. It's really a question of what do you gain from the safety of regulation, and what do you lose from this being a commercialized product.